you. Swadikap. Ohio. Hello, good morning, everyone. Firstly, I'd just like to take the opportunity to thank the members of the TOSSM committee to invite me to talk today. It's only a short talk, but hopefully something a little bit different. It's coming from a different angle. So my name is Dr. Andrew Mills, and I'm a consultant psychologist currently working at Mahidol University's College of Sports Science and Technology, along with Professor Wiwarat. So framed by the overarching theme of the conference and my background as a researcher and psychologist, today I'm going to briefly talk about some of the latest advancements and innovations in research and practice that extend beyond the conventional focus on physical healing and function of ACL injured athletes to look at more some concepts around psychological healing and function. So we're going to start by reviewing what we know from current evidence. So in elite sports settings, obviously, the ultimate goal of ACL return to sport protocols is to help athletes get back to competing at the same level as before their injury. However, despite continued advances in ACL surgical techniques and physical rehabilitation practices, RTS rates remain suboptimal, with a significant number of athletes or elite athletes who do not reattain their pre-injury levels of performance. I think highlighting this point, a recent systematic review in the British Journal of Sports Medicine has estimated RTP rates, or return to performance rates, for elite athletes to be around 83%. So some area for improvement there, obviously. So what else do we know? We also know that rehabilitation from an ACL injury is a dynamic, complex, multifactorial process with not just the physical and biological dimensions, but also the psychological and social aspects of an athlete's recovery. And they all play an influential role in the recovery process. Despite this, what we find in elite sports settings, I can only talk to the West, in the UK and Australia and America, is that holistic integrated rehabilitation approaches that consider the interactional effects of these influential aspects are not always effectively applied and integrated into RTS protocols. So for us, this represents somewhat of a gap in both research and practice. So the current state of play brings to the fore some important research questions that we need to address in sports medicine and sports science to bridge this practice gap. Fundamentally, the main question is, how might we advance and innovate return to sport protocols beyond the physical recovery by integrating with the psychological and social dimensions of the athlete's recovery? In elite sports settings, when we work with athletes in multidisciplinary teams, we often talk about finding the extra 1% to optimize performance so we can gain a competitive advantage over the opposition. In a similar vein or a similar way, where might we find those extra 1%? Where can we find those extra 1% to increase the RTP rates and outcomes? So to address these questions, a recent call has been made in the literature to underpin return to sport protocols with what's called a biopsychosocial framework. Situated at the interface of sports medicine and psychology, this holistic interdisciplinary perspective recognizes that successful recovery involves more than just physical healing. It requires addressing the mental, emotional, and social readiness of athletes to successfully return to pre-injury levels of performance. And this is actually taken from one of our research posters, because Mahidol, along with Waseda University in Japan, Liverpool John Moores, and the University of Parma, with colleagues there, are pioneering research in this area, looking at the key determinants of successful RTP post-ACLR from this biopsychosocial framework. So obviously a core component of a biopsychosocial approach or model relates to the influence of psychological factors on the recovery process. and certainly research shows that the psychological aspects of recovery play a critical role in functional outcomes. And a better understanding of these concepts or aspects we feel is crucial for all parties, all key stakeholders to optimize return to sport protocols. Beyond the obvious common issues that most are aware of, such as functional concerns over fear of re-injury or fear of not returning at the same level, we athletes experience a whole range of psychological issues related to maladaptive emotional responses, motivation, self-esteem, self-identity, confidence issues, and all these can interact to have profound effects on an athlete's adherence, compliance, and psychological readiness to return to sport. The psychological factors that have been predicted to have the most influence on successful RTP, high self-efficacy, so that's a form of self-confidence. It's basically a task-specific form of confidence, high internal locus of control, and low levels of anxiety. And these, in systematic reviews, have been shown to have positive associations with functional scores. In addition, perceptions of autonomy, feeling in control, having perceptions of competence in what you're doing, and relatedness, so feeling related, connected to the team, connected to the sport. These are all core components of a construct called self-determination, and that has also been shown to have a positive impact on rehabilitation outcomes. I mean, to really hammer home the message here, to further highlight the influence of psychological factors, a recent survey of sports medicine physicians conducted by the International Olympic Committee found that 80% of the time that elite athletes came to treatment for an injury also discussed a psychological issue that related to that injury. And notably, a systematic review of 28 studies reported 65% of athletes not returning to play cited a psychological reason for not returning. So, I mean, they're pretty big numbers, I think you'll agree. So I think while there's widespread agreement amongst sports medicine practitioners regarding the role of psychological aspects of recovery, I think from speaking with sports medicine practitioners in the UK, in Australia, in the West, and starting to get a feel for that here, it's often unclear from their perspective how best to integrate psychological support into RTS protocols. So while screening tools like the ACL, RSI, and the IPPRS are used somewhat sporadically, maybe not systematically, often sports medicine practitioners are unsure how best to maybe collect the data, interpret the data, and act on the data if they need to, especially if no psychologists exist as part of an MDT or a multiple disciplinary team. So what's the solution? Again, in collaboration with Liverpool John Moores University in the UK, and based on our collaborative work with the English Football Association, the English FA, at Mahidol, we're looking to pioneer work in this to overcome the problem through the development of an implementation of a holistic, integrated psychological surveillance system that looks to monitor the athlete's psychological health, well-being, and performance across each phase of the RTS journey, if you will. Essentially, we're working toward developing a holistic, integrated ecosystem, if you will, of psychological support that monitors the mental, emotional, and social dimensions of the athlete's recovery. So this can be aligned with their physical recovery. So the key components that the surveillance system monitors include psychological readiness. So that's a measure of their mental and emotional readiness to perform, both readiness to return to sport, which is the traditional notion, but importantly, readiness to perform once they get back to the competitive environment. So in between performances, are they ready to perform again? So we have to monitor that. Psychological strain is a measure of early mental health issues. So we use the APSQ, the IOC's athlete psychological strain questionnaire, which is the initial triaging tool in their mental health toolkit. Psychological load, similar to training load, evaluates the total environmental demands placed on the athlete from their athletic role, the demands placed on them from their sport organization, and also importantly, which are often overlooked, the demands placed on them from their non-sporting personal life, which can often interfere with their sports career and recovery, if you will. Lastly, we also look to measure pre-performance anxiety to get a measure of both cognitive and somatic anxiety before they perform, which is important, so we can track trends there. So to get an understanding of how this works, psychological health, well-being and performance exists, again, on a continuum or a spectrum. So at one end, we have athletes who are mentally strong and can achieve peak performance and activate their full potential, so no problem with them. Conversely, at the opposite end, athletes who might be experiencing some psychological problems that, if left unattended or unaddressed, can interfere with their life and performance. So in simple terms, what longitudinal or psychological surveillance tracking can do is help determine where athletes sit on this spectrum at any given time during the RTS journey. And that's one of the key fundamental reasons why psychological surveillance matters. In essence, it matters, it's important because it helps to identify athletes at risk, so we can enable timely intervention and support. So it's a proactive approach rather than a reactive approach that can prevent more severe or chronic psychological problems from developing. And it also supports an athlete's reintegration to the competitive sport environment by monitoring a range of interrelated psychological dimensions that might impact their successful RTP. So just briefly, we've only got a few minutes left, but how it works across the key RTP phases. When I work with them, normally after injury or rehabilitation onset of treatment, I would have a one-to-one with the athlete, and that is underpinned by a therapy called acceptance commitment therapy, or ACT. And that's to help the athletes decompress from what's happened to them. Normally the emotional trauma at that stage is very high. So we help process the emotion, try to accept what's happened. Don't dwell on the past. Don't look too far ahead, and then help them create some values-based committed actions to help them move toward their goal rather than moving away from their goal. Then during the rehab stage, we would measure psychological readiness using the traditional validated tools, ACLR, RSI. That's a measure of confidence in knee function. That's normally every 4 weeks. We also, at this stage, throughout the process, measure psychological load. Psychological strain is start to measured once they return back to the sport environment. So return to training and then return to competition. Again, it's a retrospective measure over the past 4 weeks, because that's where you can start to see problems that might develop once they return to the training environment. And psychological readiness to perform is a brief screening tool that we use in between performances. So they perform, and then ahead of the next performance, how do they feel? Are they still feeling confident? Have they recovered emotionally from the last performance? Are they focused? And how is their motivation? Because if we see drops in that, obviously then that might be, what we find is there's a high correlation between confidence levels and re-injury. So we need to monitor them over time. And then lastly, pre-performance anxiety. And what happens is if we intervene, if they maybe over the threshold for any of those items, and then we can refer them to the necessary parties, mental health clinician or the sports psychologist, if they meet the threshold for intervention. Going back, I think what this does is help, it's criteria based. So you move through the phases looking at not just the physical function, but also as a multidisciplinary team, shared decision making, looking at also psychological function as to whether they move through the phases. Lastly, I've got 10 seconds. So again, the key takeaway for me is to consider the psychological aspects of recovery in your own practice. Explore ways that psychological support can be integrated into your practice to work in harmony and alongside with your athlete's physical recovery. Some of these things you might already be doing, and that's great, but it's just important to bear in mind the important role that both the psychological and social dimensions play in the athlete's holistic recovery per se. Okay, thank you.